Good afternoon, everyone. Thanks for joining us this afternoon. I'm Kathy Robinson, and I'm the Director for the Bureau of Developmental Disability Services. Today I have with me Heather Dane. She's our Director of Home and Community-Based Services, and we are with you really today to discuss the Case Management Innovation Project, and hopefully this is something that you are all familiar with and are here to get some additional information and next steps from our team. We greatly appreciate everyone's time today, and hopefully we are able to answer your questions as well as give you some helpful information as it relates to next steps in the work that we're doing to make some critical changes to case management. So I think to just start, I just want to introduce myself to this group and have Heather do so as well. But I would feel it's important for people to understand a little bit about me and my background. Many of you have potentially become familiar with me if you attend any of the or have attended any of the Building Bridges sessions that we've hosted over the past couple of years. I have been the BEADS director for the past almost 7 years now, and have greatly appreciated the opportunity to work with a great group of stakeholders and partners. I also have had experience with the division. I've actually been with the division for about 17 years. My time actually with state government was started many years ago when my now 20-something-year-old was in the First Steps early intervention system. Because of some significant health issues he had at birth, he was very much in need of early intervention services. And that is where I was introduced to that program. And it's also where I was introduced to this idea of service coordination or case management and the value that that brought to our day-to-day lives and how much it helped us in navigating the different supports and resources that we needed at that time. So I certainly have that in the back of my head as far as looking at how case management works in BDDS and wanting to see and wanting to strive for every individual and family involved in our services to have a positive experience with that service. I think, before I hand things off to Heather, I would just say, I know I'm in a position where I'm hearing from stakeholders who maybe are pleased with this decision and some who are not. And I'm certainly familiar with change and people who are upset about change. I think given my personal and professional background and the significance that case management or service coordination has had on my life personally, I do go into these discussions saying I'm excited about changes, but it's a reflection of my personal experience and what I think we should strive to see for every individual and family involved in our services. So to hear families talk about just the disparity of experience they have encountered with case management, that the regret that they feel, I guess, when they recognize that they made maybe not the best decision that they could have made because they didn't have all the information and resources to do so is really sad and difficult for us to hear. So it's happened to me as well. And it does happen probably more often than people are aware of. So figuring that out, I think for us is a critical step in moving us forward in this space. So with that, I will have Heather Dane introduce herself.
Hey, good afternoon, everybody. Thanks for joining us. So for those of you who don't know me, so my name's Heather Dane, and I am the Director of Home and Community-Based Services here at BEADS. So I came to BEADS probably, I don't know, it's been almost 4 years now, as the Family Engagement Specialist. And so I came into that role as a mother who has 2 children with complex medical issues and developmental disabilities. And so I came into this role with that personal experience, but also the professional experience of I worked in advocacy for many, many years prior to coming to the state. I worked for Family Voices and I worked for the Arc of Indiana. And so really helping families kind of navigate the systems and services to really help them kind of achieve their goals for what they envisioned as their best life. And so so I come to this position with both of those perspectives. My son sadly passed away several years ago, but he was on a waiver. And then my daughter is currently on one of our beads waivers as well. And so I know from that experience in the past and even today how important it is to have a case manager that you can rely on and that can really give you, that you can build a relationship with and really kind of help you weed your way through and navigate all the things that that may potentially be available to you that really helps you to help your child or to help yourself reach your fullest potential. And so, I kind of mimic Kathy's sentiments in that, when we went around the state and talking to families, and hearing about their experiences with case management, I really loved hearing those really great stories about how much case management really had a positive impact on people's lives. And I think, what we really hope to gain through this is that is everyone's experience and not just a few. So we really are hoping that this provides you with an enhanced case management service that really can help you think about all those different things that can help you reach your best life.
Thanks, Heather. I think to just start quickly to just revisit for our audience what our aim is. Really, our goal has been for some time to really look at how we can provide integrated supports and services within the context of a person, family, and their community. And I think really a critical element or foundation to being able to do this is having a equitable and consistent case management service that helps the person continue to have those family and community supports and connections in their lives, while also providing an array of waiver services and supports and other types of services and supports where needed, so that that person continues to have that that family and community connectivity. And that really does require a special kind of case management approach and in conversations to be able to develop that. And I think we've made some strides in the past several years in moving toward those conversations and planning approaches. We still have some work that we need to do, and we think this case management innovation work is better positioning us to be able to do that. So I think as part of this transition, what we're hearing is, some questions from individuals and families asking us what is this 1915 B4? What are all those letters and numbers? Really, it's basically a structure that the federal government allows states to operate to create contracting for specific waiver services. And in this situation, it is case management. You'll see in the course of our presentation today that through our contracting process, we have identified 6 selected case management companies, and we'll talk a little bit more about what that means. But that 1915 B4 is really sort of just a construct or kind of a waiver mechanism that is not otherwise available in our existing our existing waivers, and they require separate review and approval by CMS, which is going through that process. We're currently going through that process right now. With that, I would say, if you're not familiar with this mechanism or these contracting kind of options, they're very common in other states, particularly lots of other states use this means by which to better improve and enhance the consistency and quality of case management. Different states have used this as a way to deliver case management services across the country. Indiana also has previously used this and currently uses it in the space of the Division of Mental Health and Addiction. So it's not completely foreign to us and somewhat familiar. And I think as we talk about this, those of you who are familiar with the First Steps Early Intervention System, as I am, having received those services and having been the director for First Steps for a while previously, this is also a very successful type of structure that First Steps utilizes for their service coordination activities. So it's not the same thing, but it's very similar to that model, and we've seen some promising practices there that we hope to be able to apply in this space. So as I said, we're going through that review and approval by CMS now. They do know that we are pursuing this contracting approach, so they're well aware of our transition process and plan moving forward. So I think some of the things that we wanted to ensure that we touched on for as we see them as opportunities in the case management contracting space is really some consistency. I think consistency across a lot of different areas in that service where we maybe aren't seeing that consistency today. And that really is a reflection of hearing a lot of feedback from individuals and families where they're just having an inequitable experience or access to different resources and supports for the individual and services, and that is somewhat connected to the way in which their case manager is able to creatively think through solutions and options in that space. And so we want to make sure that there is consistent messaging so that individuals and families are hearing similar pieces of information about things that are happening, resources that they can access, and really creative problem solving, because we all know that there's challenges in terms of ensuring that people have staffing and supports, and how do we really think about that differently and have the case manager well positioned to be able to have thoughtful conversations with individuals about how to navigate that. We also know that there's some need for more consistent training, coordination, and planning. There's a lot of things that case managers really need to be trained on in order to be able to effectively do their work. And just making sure that we have an alignment in what that looks like from case management company to case management company, and that we have a quality approach to delivering that. I think it's also recognizing in this space that we do want to see case management companies be successful, and we want to partner with them in a way that better positions us as well as a state agency to ensure that that is happening. And so we have the ability to provide some technical assistance in a manner that maybe we haven't been able to do before. We also have the ability to have a closer partnership, which I think a lot of the case management companies had actually agreed and articulated with us that they felt that was a needed change, because this service is different. It's not quite like many of the other waiver services that we administer, and particularly case management coordinates and supports a lot of the service delivery happening in waiver, but also outside of waiver services. And so making sure that that is happening is critical in this project and even outside of it. So I think continuing in that space, I think we recognize that we have also some shifts in what individuals and families want to see in the waiver services and what they want to see and receive from their case management services. Really, they want to get connected to a variety of different types of support. So if they really are maybe struggling in a particular area, getting staffing in the schedule for a certain shift, or to participate in a particular activity, how can we position the case manager and the case management company to help connect to other types of supports or options for them so that they can continue to move toward that outcome or that goal that they're wanting to see for themselves, and we can continue to think about how those needs are going to be met. I think we also recognize that individuals want to look at employment options for themselves. They want to look at how to navigate their daily life, and they want to have conversations about how to be in healthy relationships and what that looks like. And I think our approach is to align some of our training and technical assistance to case managers so that they're better positioned to navigate these types of conversations across the state with different individuals who may have different needs depending on their situation. And we're hoping that we see some greater individualization and person-centeredness in these spaces. As I mentioned earlier, we recognize that case management is a different type of service, and I think this transition in the contracting space recognizes that as well. It definitely allows for greater coordination and connectivity with us, but also as we look at the BEADS district offices and our own kind of front door as individuals and families come into our service system and they go through that intake and eligibility process, which we also agree needs some work and improvement, which we're tackling. I think we also see the connectivity between those front door conversations that are happening with the BEADS district offices and those conversations that are happening at the handoff to case management companies. And so with that, we were recognizing the value and significance of the case management service, and that it is a foundational service which other supports and services are coordinated. So we really are trying to align ourselves better as a bureau, as a state entity, along with the contracting piece for case management, so that there is some greater seamless coordination and facilitation, so that individuals and families have an overall better, more streamlined experience coming into our service system. So as I know many of you are aware, on October 1, the Indiana Department of Administration announced the contract awards for case management through a request for services. The following 6 case management organizations were selected: Indiana Professional Management Group, or IPMG, Unity of Indiana, Inspire Case Management, Columbus Organization, Connections Case Management, and CareStar of Indiana. And you can see here on this slide, we've listed the phone numbers for those organizations for your reference in the event that you do want to jot those numbers down or want to contact them as a follow-up to this presentation today. For those of you who may not be aware, I do just want to take a few moments to remind people of our steps in this process and the activities leading up to this October 1 announcement. So in May of 2021, we announced on our website and through our listserv our intent to pursue contracts for case management services, and that was also published on our Facebook page. As part of this announcement, the Indiana Department of Administration posted all of the relevant materials to their website publicly for access to interested stakeholders. So the materials posted included a sample contract, a technical proposal template, among other things, as well as the elements or areas of case management service delivery and structure that all applicants would be evaluated or scored against. The posting of this information is required by the Department of Administration, but it is also an effort on our part to be transparent with stakeholders just regarding the areas of priority that we laid out for the delivery of case management services. So we listed in the technical proposal some questions that the respondents had to answer. We asked them questions about how they would handle complaints and what is their complaint investigation process if families are unsatisfied with case management services. How would they ensure that the services that they were delivering were going to be person-centered and individualized and meet the needs of each individual that they are supporting? And how are they structuring their training of their case management and case managers and providing supervision and support to them? So there were a number of different things. I think there were maybe 8 total sections that we asked respondents to propose what they were going to do and how they were going to do it. And that's information that that we looked at as part of this process. So in August, BEADS then offered up waiver amendments on our website. Those were posted for public comment for both the CIH and the Family Support Waiver to solicit public feedback on the proposed model for case management changes, along with some other modifications to the existing waivers, such as the provider rate increases and some changes that we made to vehicle modifications and specialized medical equipment. That public comment period was open for 30 days. We did receive some comment during that period. I think we had roughly 20 or so unique written responses to the public comment, in addition to some comments we received through some of the webinars that we hosted for individuals, families, and other stakeholders, where we really spent some time offering specific instructions on how to review changes in our waiver amendments and how to provide public comment on those changes. And then we also shared with the attendants of the webinars what some of those specific changes being proposed were. So that really brings us up to where we are today. As I mentioned, the award announcement was released October 1. Letters to individuals and families went out last week to make contact via mail with individuals and families, just further informing them of the selections that were made and then their next steps if they are currently being supported by a case management company who was now ultimately selected. Over the course of the next several months, we will be working to ensure that impacted individuals and families have information and support to make informed decisions in choosing a new case management company. You'll have 6 to choose from. They will continue to receive communication directly from BEADS as part of the transition to just ensure that individuals and families are being advised appropriately to choose another case management company. Also, we have plans to be meeting with the existing case management companies over this transition period to work through individual transitions and needs of the people they support. We have a complete picture at this time of all impacted individuals, where they are across the state. We'll be tracking all transitions that are occurring to ensure that everyone's transition occurs within the designated time frame. And so we have some additional activities planned for the month of October, just to bring to your attention. Today we're doing this webinar, but we also will be doing a case manager and provider webinar this week as well. Later this week, we will also have an 1102 task force meeting update, where we'll give a presentation updating that stakeholder group on the status of this project as well. You can also be looking for a special edition of our Envision newsletter, which is the DDRS newsletter for individuals and families, just to introduce awarded case management organizations and some information that may be helpful as families are navigating that choice process. We're also looking at scheduling some meet and greet sessions, both virtually and in person, So individuals who are impacted and may need to meet or want to meet with different case management organizations may have the opportunity to do that soon, so that they can get some of their questions answered and maybe have an opportunity to just meet somebody face to face if that's something that would be helpful. And we'll probably look at doing that virtually as well, recognizing everybody's schedules and their ability to travel. We also will be tracking. As I mentioned earlier, we have a good picture, but we'll be tracking all individual transitions on a weekly basis to just ensure that people are aware of what's happening and making those selections. Hopefully your case manager in their monthly contact with you this month should be talking to you about this project. That is something that they are being directed to do so that you are hearing information about what's happening. And then in November and December, we will be continuing some of these same efforts, additionally mailing out additional letters to encourage folks to make a selection if they need to. Again, providing some updates at some of our existing advisory meetings so that people understand and know kind of where we are in the process. And then we'll be continuing to, our BEAD staff will be continuing to just track impacted individuals and their status over the course of the next several months. In December, we'll also be making probably some phone calls and connecting with people in that early part of December, particularly if families haven't chosen a new case management company by then, just to ensure that we're connecting them with a new case management company or giving them some additional resources and information to help them with that selection process.
All right. So Kathy just went through, a lot of the information about kind of what does this mean, or what does a selective contracting mean, and the process that got us there. And so I'm going to talk about kind of more specifically, what does this mean for you? So as an individual who is utilizing our services or as a family member. So a couple of things that you'll need to dates that you'll need to keep in mind. Just to reiterate, Kathy, I had already talked about this December 14th deadline. But if your case management company was not chosen, you'll need to choose a new case management company no later than that December 14th timeline. And so that is because of the implementation taking place January 1. We want to make sure that we have enough time to get everyone transferred to their new chosen case management company. And so you are still going to be guaranteed freedom of choice, just as you were in the past when it comes to case management and any waiver service for that matter. So, you can always change your case management company at any time to any of the selected case management companies, and that is now through the future. And that's also true for all of your waiver service providers. If you are unhappy with any of those, you always have the ability to change those at any time for any reason. And just as a reminder, case management is a required service. And so that's why it's so important that we get everyone to their new case management company and that you guys choose prior to that December 14th deadline. So then a couple of other points that I think will be helpful. And, we've gotten a lot of questions even since May when we released that, but even more so in the last 2 weeks since we released the awarded case management companies. So first and foremost, there's not going to be any change or loss in your waiver and your services, and that includes your budget. So this, this change has no fiscal impact whatsoever to your budget, and it also doesn't change the way your waiver works or the services that you can access. So your waiver follows you, it doesn't follow your case manager. If your current case manager is thinking about moving to a selected case management company, so say you're with one of the companies that hasn't been awarded and you're talking with your current case manager and she or he is looking for a job with the awarded case management companies and they get hired, you can ask your case manager which company they're going to and follow them to that new company if that company allows. So what I would suggest is that, you're talking to your case manager and she says, hey, I've been hired with case management company A. And so then you're going to want to call that case management company A and just say, I'm currently with Sally and I understand that she is going to come and start working for you and we would like to follow her, and just talk through with them, what that process could look like. And so there are no restrictions or any barriers to that happening. So that is something you can ask your case manager where they're going and then potentially follow them to that new company. And then the other kind of question we get a lot is, around the selected case management companies being statewide. So, as it stands now we currently have 10 case management companies and we're going to 6. And so out of those 10, they're not all currently statewide. And so part of that RFS was requiring that they would be statewide. And so just like when you pick any other kind of waiver service, when you get that choice list or that pick list and you see the address of that company, that's really just the company's home address or like their home base address or office address. That doesn't represent, where their case managers are located. And so, those companies, they may have their office in Indianapolis or Greenwood or Fort Wayne or wherever, but their case managers live and work in your community. And so those case managers that they hire will still have that knowledge of the resources that are specific to where you live, because we do recognize case managers, when they have those relationships and those connections within the community, they're able to share those things with you on a much better scale than if you were working with a case manager who lived 4 hours or 5 hours away from you. So just know, that's that part really isn't going to change. Those case management companies are going to have case managers who live and work in your community and have knowledge of those resources. One of the other things, like I said earlier, so your waiver and all the processes that go with that follow you, the individual, and so they are not tied to the case manager or case management company. So all of those things, and some of you may be aware of some of these terms and some of you may not, but any kind of budget modification requests, your yearly or annual budgets, your CCBs, your incident reports, transitions, all of those things are tied to the individual. So those are going to go with the individual. They're not tied to the case manager. So all of those processes are going to stay the same and there should be no interruption in those things. The providers who you use, the other waiver service providers, they'll get, once you choose the new case management company, they'll get an updated notice of action just so they know who the new case management company is and who that new case manager is. So all of those things should stay the same. So, when you choose a case management company, just like any other waiver service, it's a very personal choice, and it should be a decision based upon your individualized needs and preferences. And so, Kathy had talked earlier about we're planning several different avenues for you to learn more about those case management companies or those new ones. But here are some other things that you could do. So, you can visit their website or their social media pages and attend any virtual or in-person fairs that we will be hosting or that those case management companies will be hosting. Also, I know this is a big time for transition fairs. And so a lot of times case management companies are a part of those transition fairs. So if you have one coming up in your community, you may want to check it out because you may have the opportunity to meet some of the case management companies at that time. And then, I always say talk to other individuals and families, hear what their experiences have been. And knowing that, everyone has good and bad experiences. And so, but other family members and individuals can really be a great asset and resource to learn more about what their experience has been, what the company's principles and values are and policies and how those things have worked for them. So we also have put together some information and resources, and they are available on our Case Management Innovation webpage. And we are going to be constantly updating that, providing some additional resources on there as the days and weeks go on. So, for instance, even this webinar is going to be recorded and will be put on there for future use, or for people who were not able to attend today, they can see it. But you'll see on there, we have developed a toolkit for individuals and families. And so that really kind of gives you a lot of the information that we've been talking about today and kind of what to expect throughout the process and those timelines. And then there's also a frequently asked question document on there that is specifically for individuals and families. So you'll see we also have one that's for case managers, and we also have one that's for providers. And you're free to look at all of them, but we will be updating those as we continue to get questions. And then we will also have a document on there about how to choose a new case management company, some things to consider when you are calling them and talking to them. And so all of these resources, your current case manager should be sharing with you. So, we realize that, making these decisions can be tough, and that you're going to want as much information as possible. And so every month in October, November, and December, your current case manager should be working with you and talking through and sharing all of these resources with you and really helping you through that process of transitioning from your current case management company, if it's one that was not chosen, to one that is. And so they already have all of this information was directly emailed to them. So they have all of this already in their hand. And then, like I said, it will be on our website within the next couple of days at least. So, and so just pay attention to that website as well. We also will share, as we update that website, we'll share that on our Facebook page. So it's another place to kind of stay up to date. So speaking of staying up to date, here's some ways you can do that. So, as I was saying, you can visit our Case Management Innovation webpage, and so we will continue to put information on there. You can follow our Facebook page, where we will share information and resources as we go along. Kathy and Jessica Harlan York, who is our director of our Bureau of Quality Improvement Services, every other Friday does a Facebook Live. And so at noon, every other Friday at noon. And so you can get on there and they'll share any kind of updates or resources or things that are going on at that time. You can sign up to receive DDAR's announcements. So that's the Division of Disability and Rehabilitative Services, which is like our mother division. And so if you get on that webpage, the Division of Disability and Rehabilitative Services webpage, you'll see where you can sign up for the announcements. So I'll tell you, the things that go through the announcements are for providers and for families. So you may receive a lot of information that is really provider specific, but is also a good avenue to receive some of those announcements that are intended for families as well. And then, we're holding this webinar today, but we plan to hold another one in early December. And so that way we can just kind of talk through any other additional questions or concerns that have been brought up since, working through the transition, and any other kind of last minute things you need to know before the transition goes into effect January 1. So with that, I think we have some time. We can take a couple of questions.
Yeah, one thing I would add, Heather, to for those of you who maybe aren't as maybe savvy to the internet, or maybe you're not, that's not your comfort zone. This webinar, I appreciate everybody's, participation, but if that's kind of not your normal mode or what you're familiar with, you can always call your local beads district office on the phone. They are very much aware of what's happening. They are helping in this transition process. They may also be able to help you in answering some questions or selecting another case management company. And then just continue to look and check your mail, because you'll continue to get, as Heather mentioned, mailings from us kind of guiding you. And if you haven't selected, just some gentle reminders to do so in that in this transition period. So we're trying to get in front of folks in a few different ways, recognizing, yes, that case managers are still probably your best point of contact because you have the relationship, or they have an awareness of what your needs are. But also we have the beads staff, local district staff as well, and some additional mail coming to you to help you through that.
Okay. So Kathy, we have several questions kind of around the procurement process, and I thought maybe you could just take a few minutes to talk about what that process kind of looks like, and that, it is really about the proposals that are submitted and moving forward versus looking at past and historical experiences.
Yes, I think there's a collection of questions related to the contracting process that I'll try to address to the best of my ability. So our Indiana Department of Administration handles all contracting processes, the procurement steps, all of those things. Is a very formulaic process. So it is, and that is intended so that those activities are done in a consistent and fair manner. So I think when we were going down this process, we recognized that doing those contracts, we would have their involvement. So they really oversee the contracting process, how the awards are made, are posted, how the request for a particular service or a contract is posted, and the scoring of that is very much driven by the Indiana Department of Administration. So we have followed their processes in the course of this RFS opportunity for case management, recognizing their authority over those contracting pieces. And so that is what we have been able to share. We have attempted to do so. So we have early in the engagement, we did share kind of what was the rubric, or what were some of the response areas that we asked interested entities to respond to. We are working to try to get that information reposted. So now that we're through this process, people are asking again, what was the criteria, what was used, and so we're working to try to get that information reposted to a website so that we can get you information that maybe you didn't see or hadn't been made available to you before, in the event that you want to see what were they scored on, what were the things, because that was all made public and out for people to look at as well. The award notifications are also posted. And so on the Department of Administration website, you can look at this award. You can see the case management entities who were selected and which ones were not, and you can see their scores. So you can see who scored in the top 5 or 6 case management entities and who was not selected. So that information is also out there and available. I don't know how long the Department of Administration posts that information, but I do know I just looked at it today, so it's definitely still posted. And that information may also be a resource for you. I think if you just Google Indiana Department of Administration contract awards, or I think that information, you should be able to navigate to that. There's not an easy way to put a direct link there, but we might be able to do that as part of this Q&A so that people, we can maybe share that verbally in case people want to go to look at that. So that's kind of the process in a nutshell. I think when we released this RFS in May, we notified the existing case management entities of our intent to do that. And we also offered all entities who were interested a training opportunity so that they might learn how to respond to the RFS and get some technical assistance from the Department of Administration in doing that. So we offered that additional training opportunity, recognizing this might be a new contracting kind of experience for some of those companies. And then we gave them some additional time to put together their proposals. So we announced it in May. We received those proposals in July, and so with that, we those proposals were then reviewed and scored, and we are where we are today with the announcement of those selected case management entities. So that's essentially my high-level kind of talking points on the Department of Administration. This additional information about that is really kind of in their space in terms of what they can release and what they can't. And so I would direct specific questions about procurement processes and stuff to them, because they're the best position to be able to answer those.
Great, thanks, Kathy. There are also a couple of questions or concerns around not having enough case managers because of certain companies, because of 4 of the 10 companies closing. And so can you address how we are supporting the current, the awarded case management companies to ensure they have enough case managers?
Yeah, so I think a couple of things that we know just from our own information, I guess, and past monitoring is that there's an existing kind of known percentage of case managers who do leave their case management company and go to another case management company. That happens pretty regularly. I would not say it's a frequent thing, but we are familiar with that happening. And that's an allowable thing for case managers to do. What we are seeing in this space is that that appears to be the trend, in that we are seeing case managers already applying for and getting positions at those awarded case management companies. So it is not our intent to create a case management shortage. We do anticipate to see the majority, if not a good percentage, of the existing case managers to be hired by those awarded case management companies. And as Heather noted, with the right conversation, that case manager can bring with them their caseload. So the likelihood that those case managers are potentially going to be hired by an existing awarded case management company is relatively high. And so I would say we anticipate seeing that trend to be the case here, just because we've changed some of the elements to the monitoring and oversight of case management companies. Case managers themselves continue to meet the qualifications and requirements to be a case manager. So we didn't make any changes to those qualifications to impact who is now eligible and available to provide case management services. So I think what we're seeing, even within the first 10 or 11 days of that announcement, is that we're seeing positive movement as far as case managers looking and being interested in working with an approved awarded case management company.
Okay, great. I am going to put that IDOA procurement homepage in the announcements for everyone. So you can go there if you want to see the awards. And then, sorry, I'm doing that right now. And then also, one other question that I think would be good to address, Kathy, is Sorry, I'm scrolling through here.
While you're scrolling, I know there was a
Yep.
question about how do you find out where the transition fairs are? So we are working to schedule those. Currently, I think one of the things that we were trying to do, we kind of waiting to schedule these until we understood who was impacted and where those folks live. So we were trying to coordinate events in person in areas where we saw greater concentration, where there may be a greater number of individuals impacted. And so as we work to schedule those, we're trying to make those convenient for folks to get to if they want to attend in person. So I would say probably in this next week or so, we're going to be posting announcements and sending out some information to people, making them aware of those available opportunities kind of once we get those confirmed and scheduled.
Yes, thank you. And then there are a few questions around what's going to happen around there if they were due for a quarterly meeting during this time and their case manager has changed. Is there going to be, are they still going to have those meetings, and what could those look like potentially?
Yeah, so that really should continue. The delivery of case management services to you, those entities, all of the 10 case management companies are currently still approved BEADS providers with the provider agreement with us. So those 10 case management companies should still continue to be providing and delivering case management service provision as they always have. And so those meetings or touch points or things that have been scheduled, those case management companies should be continuing and adhering to those per their provider agreement with us to do so. So you shouldn't see that happening there. I'm not going to say there may be some instances where a quarterly meeting has been interrupted or there's been a scheduling conflict for whatever reason that happens today. But just in the general sense, that there should not be an abrupt impact to service delivery for case management, because those are still services that those case management entities are going to need to be billing for the activities associated with case management for those transitional months.
Okay, I think we have worked through all of the questions. So I think now Kathy, we can close.
So I appreciate everyone joining. I think we had a question. We have well over 100 folks joining us today for this presentation, and we always encourage the conversation. We try to be as completely transparent as we possibly can be. I recognize, as I said earlier, this is a challenge and a difficult transition for people and may not seem like something that you want to see happen. However, we definitely feel strongly that this is a positive transition and a place for us to set a new foundation for case management, as it really is sort of the connector piece to lots of other systems transformation things that we are looking at as part of our broader kind of waiver redesign look. So it makes sense for us that we start at that foundation with case management and build our system enhancements and improvements from there, so that those enhancements and improvements have maximum impact because we have the right case management service system in place to support it. So I've appreciated the comments and feedback today. Please know if you have left a comment that we haven't answered, it's either because we couldn't answer it, or we feel like we have answered it in the broader sense as part of this presentation. I also recognize that if you're not happy, we hear those comments as well. We do recognize that is a disruption for folks, and we're trying to mitigate that to the best of our ability and get to the other side of things where we feel like we will have learned and grown from that experience. And so I just really appreciate everyone taking the time today to listen to sort of what our plan of approach is here, and working with us through that process and through this transition period. So thank you for that. Thank you for the time. And hopefully we will all be able to see some of you in person at a future BEADS event or another opportunity, because I appreciate just the opportunity to hear back directly from people. Heather, anything else you want to add?
No, just thank you for taking time to be with us this afternoon, and just make sure you follow the Case Management Innovation webpage if possible, as well as the Facebook page. And hopefully I will get to meet you all as well during some of those resource fairs. So have a good afternoon.